What does quality healthcare mean to you?
I think of quality on three dimensions. There's obviously having access, there's better outcomes, there's affordable, low cost. So traditionally, if you look at any of these three vectors, whenever a policymaker has tried to improve access or cost or outcomes, oftentimes it happens at the expense of one or more of the other two dimensions. And so one of the things I feel very passionate about is technology is really the only way that you can introduce new technologies that have the ability to impact all of those three dimensions of healthcare in a positive way. What do I mean by that? So if you take asynchronous telemedicine, a platform like Dr. B, for example, you're able to very efficiently interact with the patient, very efficiently interact with the provider, thereby having a very low cost. You're able to improve access because you can reliably offer up, people don't have to wait days or weeks to see a doctor. They can really wait minutes or hours. And you can improve outcomes by using technology to make sure that all the information that is available on the patient can be used in determining how the patient should be treated and making sure that that's done safely and in a consistent manner. So I think it's important that we look at the various facets of quality when we're going to define it.
I feel like sometimes the concept of accessibility and affordability can be confused because people would say that if you don't have healthcare, then the cost of obtaining health coverage is prohibitive and therefore it's not accessible to those who don't have the coverage. Can you talk a little bit more about the differentiation that you see between the concept of access and the concept of affordability?
Sure. So access, I view is can I get to the medical provider irrespective of cost? Can I get to my dermatologist? Can I get to my primary care doctor? There are states in this country where to see a primary care doctor in person have upwards of 60 days in order for that to be the case. And so regardless if you have money or not, you're gonna wait. And cost obviously is the other end of it, which if you're lucky enough that you have healthcare coverage, that's great. But even Americans who have healthcare coverage today, I don't think that the metric that we should be looking at is really the uninsured Americans, because there's many Americans now that have health insurance with high deductibles and they struggle to even make the deductible payment. Most of this country can't afford a $500 hit. And if these deductibles are $3,000, it's the reason why healthcare in America is the number one reason for bankruptcy. It's the reason why 2 in 5 families struggle with being able to afford healthcare, which is remarkable considering the fact that we spend 50% more of our per capita GDP on healthcare than any other country in the world.